Have you ever heard of any condition called stroke before? Another dangerous one, okay, and you need to take it very serious. So I'm here basically to tell you what to do and what not to do. So someone may ask, what's a stroke in the first place? Sorry. So stroke basically refers to a condition which occurs when blood supply to the brain is interrupted, either due to a blockage, that is ischemic, and we have another one which is or a rupture, into brackets hemorrhagic. Okay, yes, so that one, when there is a rupture of a blood vessel that is in the brain, there is or can also cause the stroke. Okay, so now let's get into some causes of this condition. The first one has to do with high blood pressure, okay, followed by high cholesterol, followed by smoking, followed by diabetes, followed by obesity. Okay, the last one has to do with family history. So yes, let's get into the risk factors of stroke, and they are as follows. Age can also cause stroke. Of late, the age is a factor, it's a risk factor. It's not only in patients that are aged or the old people, but then it is also common in the young people also. Yes, because of this cerebral malaria and then all that. And then also the next one has to do with high blood pressure. When you have high blood pressure, you have a higher risk of having stroke also. And then when you're a smoker, not just heavy smokers, but when you smoke, even occasionally, you have a higher risk of having stroke. And then when you have diabetes, you have a higher risk of having it also. And then when you are obese, you have a higher risk of having it also. Now, let's get into some signs and then symptoms of this condition. Okay. First one has to do with sudden weakness or numbness in the face, arm, or leg. Okay. Followed by difficulty speaking or understanding speech. The next one has to do with vision changes and then dizziness. And then the last sign and then symptom has to do with severe headaches. Now, this brings me to the end of the signs and then symptoms. So I want to show you something. The physiotherapy management. As a student physiotherapist, as I always say in my videos, that if I don't say anything about physiotherapy management, then I don't think the video needs to be done in the first place. So as physiotherapists, we look at making sure we try as much as possible to improve mobility in our patients and also improve the quality of life of our patients, including the activities of daily living of our patients. By doing so, we need to apply specific management skills in order to achieve that as a goal. And the management are as follows. First of all, we physios try as much as possible to educate our patients on the condition and then the role of physiotherapy. Okay. And then the second thing we are going to consider is to bring in early mobilization so as to improve mobilization and the movement within the various parts of the body, including the joints and the extremities. And then the next thing we are going to consider is to bring in range of motion exercises. And then the next thing we are going to consider is strengthening exercises. Also, balance and coordination training. And then finally, we are going to consider functional activities training so as to improve activities of daily living. And then also, make sure patient is able to move freely and then perform activities that he or she wasn't able to perform as a result of the condition. Thanks for watching. See you next time in the next video. Don't forget to subscribe, like, comment, and share. See you next time. Bye.